Hello, my name is Hanizah Haji Ibrahim. I'm from Kuching, Sarawak. I'm working at bank as a clerk, bank clerk. So today I want to sharing about my my problem. For the past 6 years ago, I having a very serious sickness, but I don't know. According to the doctor, my sickness is unknown. I call that doctor also don't know what is the sickness of.
How do you feel at that time your sicknesses?
I feel very tired, joint pain, and always got high fever, and my ulcer. My mouth there got ulcer in my mouth, so I cannot. I lose weight and I don't have any appetite to eat, so that's why I lose weight from 52 kilos, drop to 35 kilos, almost 35 kilos. I think is I can't remember. I think 30 to 35 kilos, and then I got my hair loss. At that time I was the first time I admitted at one specialist. A specialist center called Norma Norma Medical Specialist Center, and then that time I'm very sick, and then by that time I don't know how to I'm so weak and so sick, so I don't know what is my problem. So I was the doctor have to take my blood, and then they have to test the blood whether what is the problem, and then after that I feel that every day they have to take my blood to test, and there is at the end I don't know, there is no result. Then they also have to take my blood from my bone marrow. You know, bone marrow at the back here, the bone marrow. They thought that maybe I have a cancer or what, leukemia, some sort like that, blood cancer or what, I don't know. So they take from my bone marrow, but at the end also there is no result. So I tell doctor I don't want to stay at the hospital so long. I want to go back and to go back so that I can rest at home. So I just take a medication from the doctor, and then by the time I don't know what type of medication they give to me, I just take it and go to follow up. But every time I go follow up, I so fed up that I have to wait for the whole day to know my result. By the end, I don't know what is my problem. So within the 2 years, I after 2 or 3 times go to see a doctor for follow up. Then after that, I so fed up, I don't want to go. So after that, second time, I also after 2 years, I admitted at a general hospital again, just because of I didn't take care of myself. And then that time, the second time, they were very serious than the first time. The same, my hair lost, my weight, everything lost. I have no energy, and then the doctor want they want to test my blood. They also very difficult to find my they want veins to test my blood, and they have to every day they have to they have to test my blood every day, so I'm so very, I don't know how to, I'm so tired, and I feel very, very, very tired. And then my urine, I got my urine also, not very good, to say, very dirty, contain a lot of protein. And then when you are sick, you didn't take anything, then of course you have got, you are not very healthy. So that at the time they keep, within 4 weeks they have to give me high doses of steroid to control and to this what you call, to maintain my blood, and then to diagnose that by 4 weeks after that, then they know that I was diagnosed as a lupus patient. This means SLE. This SLE means that you have auto-self immune disease. It's some sort of disease. So this means my antibody are very weak. So I need something to control my cells, especially my white cells. The white cell is our antibody. So to control my cell to act more active, so it will affect my kidney, my heart, my brain, everything inside my body. So lastly, so by the time I taking penicillin, and then I think when I take penicillin, you can see here my face become moon face. It means very round, but my body is the same as usual, as maintained as usual. Only my face it become